Welcome to my YouTube channel. Today we're going to talk about diabetic embryopathy. Kindly subscribe, it will cost you absolutely nothing. Diabetic embryopathy literally refers to a spectrum of congenital anomalies that usually takes place in the offspring of the mother with diabetes, particularly gestational diabetes. This occurs in gestational diabetes because gestational diabetes is when you already have pre-existing diabetes before conception. So during the first trimesters, already we have diabetes, and this diabetes causes or disrupts the process of organogenesis. Therefore, in the end, you'll develop anomaly in comparison to gestational diabetes, which develops after 16 weeks, after already gestational diabetes has already taken place. So that's why we find diabetic embryopathy is most commonly in pre-existing diabetes or pre-gestational diabetes. So diabetes related pregnancy complications. These are complications that when we have diabetes, we will develop these complications in pregnancy. So kind of diabetes predisposes a patient to have these conditions. So as you can see here, for example, preeclampsia, it is high in patients who had diabetes mellitus. Stillbirth, it's also high in patients who had diabetes mellitus. In addition to neonatal maternity mortality, macrosomia is a big baby. So when you have hyperglycemia, which will actually be distributed back to the body, which will be distributed through the placenta into the fetus, meaning this fetus will grow and produce more insulin producing fats, meaning we'll have a big baby. Shoulder dystocia, this which is a complication during labor, and then anomalies, which is more in 7 to 9%. Kindly note, in pre-existing diabetes mellitus is when we have predisposing anomalies compared to when we have gestational diabetes mellitus. This is because gestational diabetes mellitus occurs past organogenesis, that is 16 weeks past, after already we have had our organogenesis. However, pre-existing diabetes mellitus is present during organogenesis, so it affects the development of organs. So how do you detect malformation? You detect malformation by number one, first trimester HB1C. Already we said the malformations will occur in first trimester where we have organogenesis. So a higher HB1C indicates that we are not actually controlling this glucose. So in addition to that, first trimester screen of alpha fetoprotein at 16 weeks and the quad screen the quad screen test, which include after alpha fetoprotein, is beta HCG, in addition to that, unconjugated estriol and inhibin A. So it is a test that contains three components, as you have said, beta HCG, alpha fetoprotein, inhibin A, and unconjugated estradiol. You also do an ultrasound at 13 to 14 weeks to detect obvious anomalies such as encephaly, among others. You can also do a comprehensive and anatomic survey at 18 to 20 weeks, and in addition to that, you can do a fetal echocardiogram at 20 weeks if necessary.